The city manager is the one who actually opens the EOC. It doesn't open without the city manager deciding when it's appropriate and then also closing it. Since it's a pandemic, we've had to physically distance, so there's fewer people in here, and it's considered a partial opening, which means we're doing a lot more virtual meetings in our efforts to talk with the other departments.
We do the majority of the support for the remainder of the city departments in terms of what their needs would be when it comes to some of the personal protective equipment. We are also responsible for consolidating a lot of the data as it pertains to everything that's happening with the pandemic.
Arizona Department of Health Services, so the ADHS website, as well as the Maricopa County Public Health websites, were sharing data, but it was pretty broad. They were not able to show city by city how many cases there were, but they were able to eventually give us zip code data. So we then were starting to compile how many cases were in the city of Mesa based on zip codes.
We're not so much focused on number of cases and number of people that have been tested. We're looking at things in terms of more the hospital utilization. So we're looking at the ICU bed utilization, we're looking at total hospital bed utilization, we're looking at ventilator utilization.
So for instance, if some of our hospitals are getting inundated with patients, we can send out messages to our crews on the computer in the fire truck that they may want to consider hospitals that are a little bit further away, just so that our patients can get seen more quickly and then also get appropriate care.
We've been in uncharted territory when it comes to a city of our size, where you have the majority of your workforce now has been sent out to telework from home. This brought to light what we refer to as our continuity of operations plans, where they needed to say, what are our mission essential functions in order to keep the city running?
All of a sudden, everyone was realizing that they do not have enough cleaning products, they do not have enough masks, they don't know how to put masks on. Like, that's the entire city was going through this, not knowing what to do, how to keep everybody safe, including, or most importantly, our community. So that's where we came in. So we did a ton of research trying to make sure we could get good videos and good training out to our other departments, and also researched which actual masks were going to be safe and not just safe, easily put on, like safely put on, which we call donning and doffing, and also attainable. So for a little while, we could not buy N95s, which are, for us, kind of the hallmark mask that you want to wear, but they were almost impossible to get. So we had to figure out, okay, what's the next best option for somebody that's not going to have the kind of contact that you would if you were an emergency responder. So that's one of the biggest things that we had to do, which is very unusual for most disasters. Like, that was probably a new thing to come about. We had all kinds of conversations about worst case scenario. We start having our firefighters and our police officers having to work excessive hours and they can't go home because we need their response capabilities. So how will we keep them safe? How will we feed them? In addition to that, it's other essential workers that we're going to be able to, needing to work so much that they actually wouldn't have time to eat. So one of the things we did was came up with a plan B, basically, for how to keep feeding our staff so that we can continue working. And then on top of that, when the restaurants started closing, that was another thing we were looking at for our community, is how do we feed our community? A lot of our members are either not working because they can't leave the house, or they're losing jobs. due to businesses closing and employees not being able to pay them. So how do we feed our community? So that was one of the big things we did, and then that's how we got into the CARES Act, allocating that money to help with our community, keeping them happy and healthy just by feeding them.
Every day we put together for city management this end-of-day status in terms of it brings together any of the meetings that we wind up attending, any of the information we get from the dashboard that the state and the county put out. The city manager as well as council and the mayor use that data to make decisions in terms of what the city needs to do. The decisions we're making on a citywide basis are truly data-driven.
We also try to track all of the lessons learned. So that's one of the big things we do, is try to keep track of everything that we've done that maybe we could have done differently. As a fire department, police department, and city, doesn't matter. We keep it all in a log so that at the end of this we can have an after-action review and then hopefully learn for it in case there is another pandemic or some other disaster in the city.